Hi everyone, and welcome to Insulation Matters, the podcast where we shine a light on the tools and technology that keep modern surgery safe. I'm your host, Anajeriee, a surgical technology student with a passion for patient safety and process improvement. Today, we're going deep, no pun intended, into the world of laparoscopy, a minimally invasive technique that has revolutionized surgery. But we're not just talking about what it is. We're digging into a hidden issue, insulation failure in laparoscopic instruments, how it causes serious patient harm, increases costs, and what sterile processing departments like ours do to improve it. So what is laparoscopy? Laparoscopy is a type of surgery where small incisions are made, and a camera called a laparoscope is inserted into the body. Through other small ports, surgeons insert instruments to perform procedures, removing gallbladders, repairing hernias, even doing complex colon resections. The benefits of laparoscopy are well known. Patients experience less pain, shorter hospital stays, faster recovery times, and minimal scarring. For hospitals, that often means better patient satisfaction scores and lower overall costs. But this technique heavily relies on electrosurgical energy, essentially, electricity delivered through insulated instruments to cut and cauterize tissue. And here's where the danger lies. If the insulation on those instruments is compromised, unintentional burns can happen inside the patient's body. Burns that are invisible during surgery and sometimes deadly after. Now, let's talk numbers. Research shows that up to 20% of reusable laparoscopic instruments develop insulation damage over time. These are hairline cracks, pinholes, or peeling that you can't always see with the naked eye. And that means electric current can escape through these defects. The result? Burns to surrounding organs like the bowel, bladder, or even major blood vessels. Some of these burns don't show up in symptoms until hours or days after the procedure, which delays treatment and can lead to fatal outcomes. One study published in Surgical Endoscopy found that 67% of stray energy burns during laparoscopic surgery went unnoticed at the time. And get this, 25% of patients who suffer these burns die as a result. And still, many hospitals don't have formal insulation testing procedures in place. Besides patient safety, insulation failure comes with serious financial consequences. In one large hospital system, repeated repairs and replacements of damaged laparoscopic instruments cost more than $500,000 annually. That doesn't even include the potential legal costs from burn-related malpractice suits. Then there's the comparison between reusable and disposable laparoscopic instruments. You might assume that disposables are safer, and in some ways they are, but they're also 9 to 19 times more expensive per procedure. Hospitals face a tough decision: pay for constant replacement of reusable instruments, switch to pricey disposables, or do what's often most overlooked: implement a solid testing protocol in the sterile processing department. So what can we do? The answer lies in education, equipment, and collaboration. First, SPDs should be using active electrode insulation testers, like the McGann tester. These devices allow you to run a probe along the shaft of an instrument and detect insulation breaches within seconds, something human eyes or gloved hands can't do. It's fast, efficient, and helps you stop a dangerous instrument before it reaches the OR. Second, some hospitals have adopted active electrode monitoring systems, or AEM. These are special cords and adapters that automatically redirect stray current away from the patient's body. In lab studies, they've eliminated stray energy burns entirely. Third, SPD techs should always inspect instruments under lightened magnification. Any defect found should be logged in a tracking system, not just for documentation, but to monitor trends over time and identify repeat issues with certain vendors or products. Finally, collaboration with the OR team is critical. Let them know which instruments fail inspection and why. This helps surgeons understand the role we play and builds a culture of safety. We're not alone in this mission. Professional organizations like AORN, the Association of Perioperative Registered Nurses, have clear guidelines stating that all insulated instruments should be tested for integrity before each use. AAMI's ST79 standard also supports routine inspection and preventative maintenance. But these recommendations only work when hospitals put them into practice. And that starts with well-trained SPD techs like us who understand the risks and know how to respond. SPD staff should be trained to recognize damaged coatings, know when to remove items from circulation, and have the confidence to speak up when something doesn't look or feel right. So here's what we've learned. Laparoscopy is powerful, but it comes with hidden risks if equipment isn't properly maintained. Insulation failure is common, dangerous, and often invisible. SPD techs are the front line of defense. By using the right testing tools and inspection methods, we can stop burns before they happen. Hospitals can save lives and money by investing in preventative systems and cross-department communication. Here's what you can do next. If you work in or around sterile processing, ask if your facility uses insulation testers. If they don't, advocate for it. If they do, make sure you're trained and confident in using them. You might just prevent a tragedy. Thanks for tuning in to Insulation Matters. I'm Anajeriee Haley, and I hope today's episode inspires you to take a second look at the tools we clean and prep every day, because the safety of every surgical patient depends on it. If you found this episode helpful, please like, comment, or share it, and don't forget to check out the show notes for full citations and resources. Stay safe, stay sharp, and I'll see you in the next one.